that we are coming here for last 20 years struggling to spread awareness about obesity as a disease, and there has been extreme contribution from all of you in making people aware that it's a disease and it is a service. So we are here only because of your support in creating awareness. So first of all, let me thank you for that. 20 years back, I came here as a bariatric surgeon. We were struggling to approve bariatric surgery as treatment. Over time, with severe obesity, BMI, high BMI, huge patients, it got accepted. The best thing happened when the government of India, the insurance regulatory authorities approved obesity as a disease and started covering bariatric surgery expenses, which declared obesity as a disease. But we are only looking at those who have very high BMI, extreme cases, and then we realize that probably there are many others who need early treatment, timely treatment, which can prevent them from going into this stage. Today there are many new medications available which can prevent progression of disease to severe disease. But everyone should know when to start, where to start, how to start. ओबेसिटी ऐसी बीमारी है जो हर एक के पास, प्राइमरी केयर फिजिशियन, डायबिटोलॉजिस्ट, कार्डियोलॉजिस्ट, सभी के पास पेशेंट आते हैं. पर ट्रीटमेंट हर एक को पता होना चाहिए कि इसको ये ट्रीटमेंट लेनी चाहिए. एंड दैट इज मेनली बिकॉज मेजॉरिटी ऑफ द डिसीजेस, non-communicable lifestyle diseases are induced because of obesity. Many other diseases get aggravated by obesity, like all inflammatory diseases. Even COVID outcomes were worse in those who are obese. So, to give this new science to entire physicians, government, insurance authorities, we took this initiative. Dr. Neeta Deshpande was a lead. We collected all guidelines, the best guidelines across the world, compiled them together. And we realized that American Association of Clinical Endocrinology, American Cardiology Association, Canadian guidelines have adopted a new system to identify who needs aggressive treatment, who needs early treatment, and then which was absent in our country. If you look at what is just now being offered, maybe surgical treatment is for those who are extremely obese. Visually you can see he is very big, okay, then you go to bariatric surgeon. Medical treatment, someone is extremely distressed with diseases, uncontrolled diabetes, only then medical treatment is added. Now in life, if you see, for everyone, psychology, functioning are important part of happiness, quality of life. If you see a patient who has severe pain, breathlessness, backache, neuropathy, is not severely overweight, but obesity has induced these diseases which destroys his day-to-day functioning ability, activity, overall productivity for our country, overall productivity for the family. At the same time, all these things also induce various psychological challenges in that person's mind, that I am unable to do this, I am unable to enjoy. And psychological impact is important. If you look at worldwide, functioning disability, functioning impairment, psychological impact are also included as diseases induced by obesity, and then importance is taken. And that is why we gathered all those guidelines, cardiologists, gynecologists, diabetologists, physicians, obesity specialists, bariatric surgeons, everyone came together to decide what is appropriate as an algorithm of treatment for Indian patients. And then we published this paper in Journal of Association of Physicians of India. I am going to give a brief presentation, but before that, you must hear from an expert who treats obesity without surgery. So everything is not from a surgeon.
That's okay. Quickly introduce myself. I am Dr. Neeta Deshpande. I have been practicing obesity and diabetes for the last 25 years. So, as Dr. Shashank very rightly said, obesity has grown exponentially in the last few years. The latest ICMR study tells us that diabetes, overweight and obesity is almost to the tune of 30 to 40%. That means 1/3 of our population is getting overweight and obese. On the one hand, India is battling malnutrition, not enough to eat. But on the other hand, 1/3 of people are also getting fat, overweight. The second thing that everyone needs to understand is that obesity is the mother of all other diseases. It leads to diseases which you all know that obesity is connected to diabetes, blood pressure, heart disease. How many of you know that obesity is also related to cancer? Obesity is also related to mental health. And obesity is related to mechanical complications. What do we mean by mechanical complications? We mean osteoarthritis of the knees. खूप काळ जर कोणी लठ्ठ असेल, ओव्हरवेट आणि ओबीज असेल, तर त्यांच्या गुडघ्यांमध्ये जी वाटी असते ती झिजून जाते. द कार्टिलेज इज गॉन आणि मग यू हॅव टू रिप्लेस द नीज. सो नी रिप्लेसमेंट करावी लागते. नोबडी टॉक्स अबाउट दिस. So even the insurance companies, they only identify that we will give money only if you have obesity associated with sleep apnea, obesity associated with cardiac disease and obesity associated with diabetes. But obesity from top to toe can cause anything. There will be liver disorders leading on to cirrhosis of liver. On the other hand, you can get acidity and simple things also. And knee replacement. One knee replacement is anywhere between 3 to 4 lakhs. Both the knees together 8 lakhs. Isn't it cheaper, better for the patient to instead treat obesity or prevent it? So that is what we need to tell everyone, that obesity is a disease. Why is it a disease? The reason is because it causes all other diseases that I have talked about. So if you want to put it very simple, there are 3 M's. First M is metabolic, which means all your diabetes, blood pressure, heart disease, etc., etc. The second M is mechanical. Mechanical is your knee problem, ankle problem, bone problems, okay, and also acidity problems. These are all your sleep apnea problems. म्हणजे रात्री you keep getting up with less oxygen supply to the brain. So that is second is mechanical, and third is mental, okay, anxiety, depression. So metabolic, mechanical, mental, the 3 M's, and to that I will add the 4th M, and that is monetary. Imagine the amount of money that is spent to treat the first 3 M's, right? So it's a 4M problem which needs to be solved, and that is why it is a disease. If somebody needs to lose 3 kgs, 4 kgs or 5 kgs, they can do it on their own. But if you need to lose more than that, you need a healthcare professional. Why do you need a healthcare professional? Because losing more weight than that is a scientific problem. It has to be backed by good science, good research. If you lose tomorrow, you stop eating and lose 10 kgs on your own, you will lose hair, you will lose your skin, you will lose your bone mass, you will lose your muscle mass. So if you want to preserve all that and still lose weight, you need professional help. That is why obesity is a disease. So हे सगळ्यांच्या लक्षात आलं पाहिजे की वजन कमी करणं हे एक वैद्यकीय शास्त्र आहे, and it has to be treated as such. And that is the reason that as Dr. Shashank very rightly said, as obesity treatment is not just the domain of an endocrinologist or a diabetologist. Everybody sees obesity patients, all specialties. Cardiologist will see, he will tell his patient, वजन कमी करा, your heart will improve. A gynecologist will say, तुम्ही वजन कमी करा, your fertility will improve, PCOS will come down. Or an orthopedic surgeon will say, वजन कमी करा, तुमचा arthritis कमी होईल. Every field. So that, what does that mean? That means every doctor needs to know the basics of obesity. Otherwise, what advice is he going to give? So there are many methods of treatment today. There is diet, exercise, but that too in a very, very systematic manner. Because everyone says, I will read the internet and do a keto diet. I will read the internet and do intermittent fasting. I will read the internet and do protein shakes. But is that scientific? Not at all. What if something happens? Who is going to hold your hand? So that is not happening. So diet, exercise. Exercise doesn't mean marathon running and professional weightlifting. It simply means to preserve your muscle mass and lose weight. So diet, exercise, science-backed, medication, and wherever it is needed, bariatric surgery. So all these options are there, where to use, what to use, how to use. All this knowledge has to be disseminated right down to the general practitioner. So the consensus that has been prepared now goes down right to the general practitioner so that he can counsel his patients as to what trajectory his weight loss journey should take in a scientific manner. So I think that kind of sums up what we have tried to do. There's a lot of work to be done, a lot of data to be collected, but this is a good start is what we feel.
Thank you.